let's see. And welcome back to Perfectly Holistic, and I am so excited today to welcome Dr. Ruth Roberts. She is joining us all the way from Mexico and enjoying the beautiful Cabo San Lucas area. And we are going to talk about a very, very important topic that is near and dear to my heart because, like so many of you guys out there, you have had a cat or have a cat with kidney disease on some scale. And so we are going to break this disease down today for you. We're going to talk about what causes it, how to support your cat no matter what stage they are in, and just give you a lot of tools and give you some hope. So Dr. Ruth Roberts, thank you so much for joining us today.
Pam, I am so happy to be here because this topic is absolutely critical for cats. Unfortunately, my profession has not done a very good job at explaining what's going on and what all of this means. So if we can get this information out there to your viewers so that they are better armed with information, then they'll be better prepared to actually care for their cats.
Absolutely. Absolutely. So let's dive in and talk about what causes this. It's a big bucket.
It's a big bucket, but I can give you two giant culprits. Sadly, the bag of dry food is the worst thing we have ever done to cats. So there's a classic study looking at the causes of feline lower urinary tract disease, and what the person did with this study is look at cats that were eating dry food and how much water they drank and how much urine they produced, and then looked at what happened in those same parameters for cats that were eating canned food. And what they found was that the cats that were eating dry food drank twice as much water as the cats that were eating canned food, but they produced half the urine. And so what does that mean? What it means is that the dry food requires so much water to be able to be digestible that even with a double the volume of intake of water, they're still underproducing urine. And what does that mean for kidney health? The less urine, the more dehydrated chronically that cat is, and the more impacted the kidneys are. So this is, if you do nothing else and you take nothing else away from this talk, convert your cat to, at minimum, canned food. And I would say fresh, whole, real food is the best option.
I totally agree with you. And sadly, we do what we're grown up and we're shown, how we're raised pets. And I grew up in a family where we fed dry cat food because that's what my parents did, So hello, we've probably all been there. And it took me many years and losing 3 cats to kidney disease, but I finally hit myself with the 2x4 and said, what the hell what am I doing? What have I been doing to these poor cats? Oh my gosh. So yeah, you're right. Diet is huge because cats are evolved from desert creatures and they are designed to get their moisture from their food. And that intracellular moisture is what their bodies absorb so well. Oh, hello, Gunner. Look who's here. He wanted to come say hi.
He wants to come say hi.
Hello. Say hello, Dr.
He's
Ruth.
like, yeah, man. Yeah.
He is not eating kibble.
Nope.
So yes. So do carry on.
So that's one of the biggest things. And the other thing to remember is that if you are feeding your cat dry food right now, it's okay. You can take small daily steps to start to change that. So famously, one of my cats, Romy, who lived to be 24, uh,
Wow.
when I finally, I mean, right. So when I finally realized this, like, oh, geez, what an idiot I'm being, and started converting all of my cats from dry food to canned food, it took me 6 months to convert her from dry to canned. And
Mhm.
then I'd started using the original crock pet diet at that point. It took me an additional 3 months to convert her from canned to cooked food. And it took, a great deal of patience and literally starting with a half a teaspoon a meal. And so
Yes.
be patient, but be persistent and literally start with something you think they'll just adore and start with half a teaspoon per meal. Put it to the side so they can smell it and kind of look at it and eat around it and do their, cat
Mhm.
decision making process.
Yes.
And then eventually, after a week or so, put it in the center so they kind of have to get a little
You're right.
closer to it, and then you'll start to see it going, actually disappearing. So be
Mhm.
patient. Yes,
Mhm. Great advice because cats are they're such creatures of habit. And if they have been eating dry food all of their life, they're looking at that going, "What is that? That's not food."
and
You know?
yeah,
They
and
don't
and there
know.
are some they don't know, and they're like, "No." Plus the pet food manufacturers spray the outside of the kibble with stuff that's like Lay's potato chips.
Yes.
So there are cats that just will not eat canned food, but that's pretty rare. So I think it's definitely
Mhm.
continue with persistence and patience, and I think you'll find things change dramatically.
Yes, and I find that some people are impatient and they give up too fast. "Oh, I tried that. If I tried that." "Well, how long did you try that?" "Oh, I tried it for several days." Your cat will outlast you. You know, they are like
Right?
martyrs times, so you have to
Yeah, and
really be patient.
yeah, and having said that too, if they don't wanna eat it, they will not eat, and this is why you must be patient and gradual, because if they don't eat for more than 3 days, especially the heavy kitties, they can
Mhm.
develop something called hepatic lipidosis, which is just not fun at all for
No.
anybody, and become gravely ill. So, this is why
Mm,
it's important to start with where you are and gradually add to, build up, and then gradually be again, patience is key here.
yes, because our cats are very that some of them are martyrs. They will, like you said, they will just not eat. So we can't
Mm-mm.
throw it all out and start, with what we want. We have to go at their pace. And so, like you said, some cats are really good at transitioning fast, and then others are just a little slower to come to the party. You know?
Amen.
You
Yeah,
have
I
to
mean, like
you
like
have to find what works for them. Yeah.
exactly. Like our cat Pepe that is living with us and traveling with us. If we don't watch him, he will literally eat everything that's not nailed down, including raw spinach, raw kale, and everything else in between. So so there's him, and then there
Yeah,
was Romy, and they, so they shared time together.
yeah. Oh, that's awesome. Yeah, okay, so do you have any, like, specific types of diets, or wet food, or do you wanna jump into fresh food or raw food or anything like that in terms of
Well,
cat
s-
kidney disease?
Yeah, so I mean, as far as, if you're trying to transition into canned food, sometimes you got to go with the really cruddy stuff because the other problem is that the dry food often has made kitties carb addicts. So if
Mhm.
you have to transition with Shiba, maybe that's not the best thing in the world to feed long term, but it is infinitely better than dry food. And then from there, then you can try cooked food. You can try a raw diet. I've found more success with a cooked diet because kitties have developed really distinct texture and taste profiles. And so
Mhm.
even though raw actually is absolutely most appropriate for this species, if we could get mouse in a can, that would be a home run. And actually, there was a woman that did that, but it didn't go off so well because of the ick factor. That would be the optimal diet for cats. But
Right.
because they have been conditioned to eating essentially Doritos for most of their lives, it's very
Mhm.
difficult to convince them that that's a good idea. So I think you
Yes.
have to just work with your cat and
Mhm.
with the goal of improving where you are and maybe having an optimal goal of a cooked version of a diet that's very high in protein, low in easy to digest sugary carbohydrates, and with some added vegetables to help support um, liver function, kidney function, that sort of stuff.
Right. And, let's talk about what who tell their kidney client patients to eat. They say, "Go get a low protein diet."
Right.
That's just I know that you're not a fan of that advice. So can you explain
No,
and talk to some of our viewers about why a low protein food is not ideal?
these guys are obligate carnivores, and the majority of their diet should be in protein. So if there's three macronutrients, protein, fat, carbohydrate, the protein macronutrient should be at least 60 to 70% of the total diet.
Mhm,
And then fat next, and then finally carbohydrate, mostly in the form of plants, because that's what would be in the mouse intestines, right? So that's where they would get
mhm,
their carbohydrate source. So that's critical. Now, when you feed a cat a low protein diet, what's going to happen? You're going to throw off their normal metabolic pathways. You're going to see them start to drop muscle mass so that they become weaker, more arthritic, more prone to other problems. And then because these diets are low protein, there's two other options to increase the caloric intake. One of them is fat, which
mhm.
is not really increased, and the last one is carbohydrate. So all of a sudden, this cat that is an obligate carnivore eating this low protein kidney diet now is eating 75% of her calories in carbohydrates. And that is why we have an epidemic of diabetes and all these other issues, including worsening kidney disease, because it becomes pro inflammatory.
I'm so glad you said that because so many I hate to bash them, but vets will pull out their prescription kidney diet in a bag. And I just want to go, are you kidding me?
Mm.
Because there's nothing worse than dry food and a prescription dry food.
Yeah.
It's like,
So, and here's the thing, the rationale in veterinary medicine is these are the kidney numbers. This is all we're concerned about. Is this what's
mhm,
on this little sheet of paper or what's on the computer screen? And
right,
the low protein diets make the numbers better. However, they're not looking at what happens to the rest of the cat. And that's the problem.
right. So that goes back to what we were talking about earlier. A vet once told me, I thought it was great advice, treat the cat, not the numbers. So, yes, the diagnostics are important and you can look at those to kind of get an idea of where you are, but then just put it aside and then go treat your cat like a carnivore. you know, feed the proper diet and then find ways to support those organs. So, yes, I'm so glad you brought that up because we don't want to replace their protein with carbohydrates because that doesn't even make sense. Their body can't even digest that amount of carbohydrate. Like you said, a cat in the wild would get their carbs, which would probably be what, 3% maybe of their diet as
Something like that. Yeah.
whatever's in the belly of the prey that they just ate would be their fiber source, would be their grasses and their plant matter and all of that. So can you talk a little bit about the role of fiber and how that would be beneficial? Like some people are like, absolutely no vegetables whatsoever. But like you said, there's a specific role that those plant foods can play in the food, not in a large quantity, of course, but in a very small quantity.
Yeah. So the big thing is the
Yeah.
microbiome. The
Mhm.
microbiome needs fiber in order to
Yes.
thrive and succeed. And so if we're throwing in highly processed carbohydrates that are going to go straight to sugar, we're going to induce dysbiosis or leaky gut syndrome in these animals. And unfortunately, I would hazard to say that almost every pet in America, dog or cat, has some level of leaky gut syndrome with a few exceptions. So if we back that up to what should these guys actually be eating? Yes, there's a very small amount of the diet that is carbohydrate, but they are complex carbohydrates, meaning it's plant-based material, some of which the cat can digest, but most of which is digested by the microbiome in the cat. And again, if the microbiome is happy, then everything else in the body gets happy. And we know that a well-functioning microbiome actually helps to improve kidney function, because then the gut can help process out waste products and take some of the load off of the kidneys.
That is a very important point, because we forget about those microbes in the gut. I mean, they have to have a source of food, or there's going to be an imbalance with them. And they're the ones that break down all the food sources, and they produce the hormones in the body, and they produce the substrates that the body needs in order to function. So,
Yes.
it's so important. We tend to glaze over that so fast because, it's complex, yes, but there hasn't been a whole lot of discussion until probably just in most recent years, and microbiome has become like a big focus all of a sudden, because people are realizing it. We've been ignoring this, but it's like a major factor of our pet's health.
Right. And I started talking about it in 2006 because of what I had learned in terms of human health. And I'm like, well, these guys are mammals too. And lo and behold, even though, a dog may be eating raw, a cat may be eating raw, their microbiomes are still quite similar to ours, with a few exception of microbes. And so if we just throw probiotics into a highly inflammatory diet, we're not going to make much of an impact, because they don't really have a way to grasp a hold of where they need to be and start to outcompete the bad guys. And it's a massive problem on all levels. But when they are in charge, they produce something like 75% of our immune system molecules, which are anti-inflammatory, and 90% of our neurotransmitters. So that's the other difficulty. If the cat, the dog, the person is dysbiotic, they have leaky gut syndrome, then their behaviors are going to be altered, because the ratio of neurotransmitters that would help us stay happy, feeling positive, is going to be diminished, and transmitters that would create depression, obsessive type behaviors, that sort of stuff, are going to be raised astronomically high.
That's so interesting. And it also ties into how the vagus nerve connects the microbiome to the brain. And so I call it the gut brain highway. And our emotions are regulated oftentimes from our microbiome. And so, like you said, if that is out of whack, then that highway is transmitting those negative emotional, neurotransmitters that we see behaviors like being irritable and being aggressive, or just unhappy and mopey, and not your normal, happy, cheerful, loving pet.
Yeah. And what's even more interesting is that there's evidence that the decisions are being made in the gut, and they're never reaching up here. So that's what's fascinating. And then there's this whole other concept of leaky brain, for instance. So if the gut's leaky, then there's more inflammatory molecules. It allows things to cross from the blood into the brain that normally shouldn't. So this field is just exploding with information, and really shows us how misunderstood all of these interconnections have been.
That's fascinating. He wants to go outside, and I don't have the door open. So
Yeah, he's like,
we're
"Come
gonna hear
on,
him
mom."
we're gonna hear him
Yeah,
talk the whole time
yeah,
until
right
we're
on.
done. Um, so yeah, okay, so let's talk about the stages of kidney disease. So let's say, someone takes their cat in and their vet comes back and says, well, it looks like your cat has kidney failure and the numbers are just a couple digits higher than norm. And all of a sudden, this pet parent is like crushed and just fearful, like, oh my God, what do I do? So, and this is
Yeah,
where your expertise really comes in as a vet.
yeah, and it used to, before I started training my holistic pet health coaches, I was doing one-to-one consultations, and this was just heartbreaking. All these folks that would come into the consultation convinced their cat was going to die in the next 6 months, when
Mhm.
really the creatinine, which is one of the things that we use to measure uh, better kidney function, was elevated by zero point 0.2 points. And it's like, well, your cat does have some kidney disease, but it does not have failure. And so again, we're back to treating the piece of paper instead of treating the cat. And also, unfortunately, my colleagues are not doing a fantastic job of explaining what each of the stages means. So there's 4 IRIS, International Renal Interest Society stages of kidney disease. 4 is the one where the cat is probably extremely sick once it is diagnosed, and vomiting, diarrhea, inappetence, weight loss, all of these things. But,
Mhm.
as we were chatting before, that's not doesn't mean that it's gonna die in a week. I've seen plenty of kitties that we gave them support with some fluids, helped settle the nausea, did some acupuncture, and then once they're eating again, then we can add in a few supplements to help support kidney function better.
Mhm.
But what I just this is just killing me because so many people will go to the veterinary hospital in the emergency clinic and they'll be told, "Oh, your cat has these numbers. It's in stage 4 disease. It's just best to euthanize." And it's like, and there are times when, but they're not even trying. So that's where
Right.
it gets so frustrating. Yeah, I mean, yes, if the cat's been in the hospital for 3 days on intravenous fluids and the numbers aren't budging and it feels terrible, then that's a consideration. But if it's been on fluids for 3 days and it's eating and it's starting to feel better, then no. That's when you say, okay, what are the things we can do to help this cat feel better?
Mhm.
You know, compare that to stage 1 kidney disease, where those numbers are ever so slightly elevated, or the SDMA is elevated, or maybe the urine is not as concentrated as it should be. Are boatloads of things that can be done to support that cat. And I would argue all the way up into stage 3, there are many things that you, the cat mama, can
Mhm.
do at home along with the support of your veterinarian to keep your cat happy and healthy.
Yeah, let's talk about the SDMA numbers because I think it's more common to see that added into the traditional IDEX, reports where used to they didn't have that on there. But the
Yeah.
SDMA numbers are actually a more accurate picture of what that kidney function looked like. Can you describe that a little bit more?
Sort of. So here's the thing about the SDMA test. It is useful in terms of understanding where levels of inflammation are, levels of kidney function. The idea is that it will become elevated sooner than the
Mhm.
creatinine will. But it's also a measure of inflammation. And
Mm,
so if there is other inflammation in the body, there's a urinary tract infection, there's
mhm.
osteoarthritis, there's inflammatory bowel disease, that number is going to be elevated and not because of the kidneys. Does that make sense?
Interesting. Yes, it does. That's
And
very good to
and
know.
and if you read the lab report, it says that there's a little paragraph under
Mhm.
every list of lab values that says, rule out other causes of inflammation.
Yes.
So when IDEX launched this test years and years ago, they actually had to increase the upper limit because what they had done was select a number that would have 85% of cats over the age of 14 in kidney disease. Right? So take
You
it all
can't
with a
make
grain of
this
salt.
up.
No, you can't. And it's like, it's like I think 2 years ago, whoever the society is on the human side that looks at blood pressure as an impact on, everything, heart disease, kidney
Mhm,
disease, et
mhm,
cetera, dropped the numbers down, the
mhm.
threshold for normal, and
Yep.
automatically something like 30% of Americans were now hypertensive
Yeah.
because of
Yeah.
yeah, and it's like, come on, y'all.
Hard, and some of the clients that I have worked with just in recent months, sadly, I've had a few that had glyphosate residues that were affecting the bladder, which affects the kidney because those are sister organs in Chinese medicine. So you can have external toxins come in too, which affect kidney function and damage kidney cells. So
Yes.
looking at things like, um, what your pet is being exposed to. And I have to tell you, there's a lot more glyphosate in low quality cat food than people realize because of the sourcing. And it's not going to be on the label of the bag,
No.
unfortunately.
Well, and sadly, Pam, I think it's in everything
Yeah.
right now. So, for
Yeah.
instance, in California, they looked at organically produced wines, and all of them contain glyphosate. And what's
Hmm.
happened is this is in our water cycle. So,
Hmm.
sadly, we are all consuming
We're
it,
all.
breathing it, drinking it every day.
Mhm.
Yeah. The other thing
Exactly.
that's important to remember too is that the urinary bladder sits here, the colon sits up here. And so
Mm.
anything that your cat has eaten, and if it has leaky gut syndrome, is going
Yep.
to transpose into the bladder, which can then ascend into the kidneys as well.
The kidneys. Yeah. So it's eye-opening when you look at how it's all interrelated. It's kind of it is a synergistic system inside the body, and you can't isolate one particular area and think that that's not going to affect the rest because it does, it
Yeah.
just does.
Yeah, yeah, and that's the thing with conventional medicine is we've isolated things into systems instead of trying to understand how it all works together, and
Collective.
that's been a critical error. And now we're, the evidence is showing us that no, really, you have to think this way, which is
Right,
kind of the concept behind functional medicine, right? Look at
right.
systems of function and how they interrelate and improve health instead of looking at just the kidneys.
Mhm. Yeah, and that's the beautiful thing of a holistic approach. You look at the entire picture. You don't zoom in on one little corner, you know, and
Exactly,
and
exactly.
just try to fix that because that's not the answer. You gotta look at the big picture and see how it's all related.
Exactly, right,
Um,
and as you said earlier with traditional Chinese veterinary medicine, it's the same concept. You cannot look at just the kidneys, you have to look at their relationship with the rest of the organs.
exactly. And let's talk about that for a second because I know you're a huge fan of Chinese medicine. And the whole concept of like the elements, we have the water element, which includes the kidneys and the bladder, and emotions that can impact that those organs. Can you talk a little bit about that for people who maybe have never heard of the elements and how they're related to the bladder and the kidneys?
Yeah, and so here's the thing that's a little bit confusing. In traditional Chinese medicine, you'll hear bladder, kidney, liver, spleen, and
Hmm.
they have similar functions to the physiologic organs, but they have other functions that don't exist in conventional medicine, or they've been assigned to other organs. So, for instance, the spleen is the main digestive organ, but really it got assigned most of the functions of the pancreas, plus a whole very elaborate and elegant understanding of digestion in terms of transformation and transportation. The
Mm.
kidneys are an incredibly integral part of almost every organ system, every system of function within the body. They store the Jing, which is your essence. So you are born with a certain amount of Jing or essence, and that's considered to be your candle of life. If you got lucky genetically and you have a long candle, great. Many of us weren't born with that. But then it's more critically important to make sure that you eat well to develop excess food or gu qi so that that transforms into postnatal Jing and will sustain your health for a longer period of time. The kidneys are also responsible for creating the base yin or cooling fluid, and the base yang or warming fluid, which can also be transformed into qi. Like, this is the fire hose explanation of Chinese medicine.
I love it.
But all of the things that work in balance to keep the body working. So if the spleen is unhappy, nobody is happy because the kidneys are not nourished. But if the kidneys start to lose their yin, their qi, their yang, their jing, then the rest of the body is in deep trouble because this is from whence all of the energy emanates, if you will.
And it's important to remind people that the kidneys are one of the detox pathways, the elimination pathways for, for clearing out the toxins in the blood, filtering that so that it can go back out through the urine, through the bladder, So if it is all clogged up with a bunch of junk that have to go through there, it can damage those nephrons, those kidney cells, and reduce kidney function. And there are only so many kidney cells, and they don't regenerate like the liver. Is that correct?
Not as quickly. They can regenerate. So, I mean, essentially every 7 years, the human body is completely new. It's just that some organs, right, but the liver is extremely quick, and so is the intestines. So I think the estimate for kidney cell turnover is 5 years. But if you already have a terrific amount of scarring, those cells cannot regenerate. And so you're left with whatever is functioning normally and hoping that they will be able to create new healthy cells.
That is fascinating. That's good to know. Maybe that's why my cat lives so long.
Well, because you were helping her, you were supporting, and so that's the thing. I mean, we can use supplements to help reduce inflammation in the kidney and help improve the function of the cells so that the scarred dead cells go away and we have the opportunity for healthy cells to start to replace them and create more functional, viable kidney tissue. So, I mean, there's several things that we know in terms of supplementation. Omega-3 fatty acids at a good dose, so literally somewhere in the neighborhood of 75 to 100 milligrams per kilogram of body weight every day is crucial for supporting cats with kidney disease and dogs as well. Using probiotics help to improve kidney function as well, because again, the gut can take on some of that responsibility. And then the supplement that has strangely been a home run for me, is quercetin, which is a bioflavonoid usually derived from the whites of citrus, that sort of stuff. But what I've seen with that is that we've actually seen creatinine values either stabilize or in some cases go down. And that's been just astonishing.
Absolutely. I love the fact that we're talking about supplements now. So let's give and those are great, 3 great ones right there. But let's talk about some of your other recommendations for just ways to support those kidneys in cats that have this issue.
So crucial is doing what you can with the food first, getting more water into the diet, whether that's, if your cat's not coming off of dry food, then try things like bone broth, other water flavorings to increase water consumption. And then the other thing is that if that's not happening and your cat's in that stage 3 and upward, that's where subcutaneous fluids are super helpful, because essentially it's poor man's dialysis, if you will. We're going to give a big flush of fluid through the system, help the kidneys dump some of those extra toxins and take a little bit deeper breath. It's also critical to make sure there's no heart disease going on, because if the heart's not functioning well, the kidneys get less blood flow with each heartbeat. Likewise with the weird thing about hyperthyroidism is that it can actually support kidney function because the heartbeat is faster and the kidneys
Oh,
get more blood flow. So you have to be careful when working with those guys.
yeah.
And then really it's up to what else will your cat take. So there are tremendous numbers of herbal formulas that are available. Standard process makes feline renal support, which has been super helpful for so many kitties. And a lot of it is because it is a glandular based supplement. So we're feeding kidney to support the kidney and the other parts of the urinary tract. Assisi loops have been amazing. So are you familiar with those? Yeah. Do you have them? Yeah. So our cat Pepe, he is 14, and a year ago his creatinine had cranked up. He kind of decided to come visit for a minute. His creatinine cranked up to about 3.6, and so and he did not have a urinary tract infection, which again is critical to make sure that's not present. But we watched his creatinine go from 3.6 back down to 2.1 with using the Assisi loop every day for about 2 months. So that's pretty profound.
So for people who don't know what an Assisi loop is, can you explain what that is? It's fascinating.
It
technology.
is literally a pulsed electromagnetic frequency, and I'm looking around for hours. And this is crazy. This is how big the device is.
Yeah.
And so it's super simple. You push the button, you put it over the part that needs some help, and it runs for about 15 minutes. What it does is help to improve blood flow into that area. It helps to help the cell turn over more efficiently. So the cells that are sick, it helps them go on to die so that healthy cells can come in. And it also improves the cell's metabolism of nutrients. It can take more nutrients in and get more garbage out. So they're really astonishingly awesome devices. They're wonderful for cats because you've got it in your home. If they seem to really enjoy them, and if things are really not so good, you can treat up to 4 times a day with it and then go down to once or twice a day, depending on what else is happening. But they're just amazing devices.
Yeah. And cats tend to really be drawn toward that PEMF pulse, that pulsed
They do.
electromagnetic. They like that feeling. I mean, I know that they even have mats that have the PEMF technology, and animals love to lay on the
Right.
mat too.
Yeah. We've got Assisi makes them, and then there's another
Oh,
brand
yeah.
called BioBalance, sorry, that's directed towards humans. But this is something we travel with because it helps us all, and we all sort of cuddle up on the mat together.
Yeah. Sam, Regina says, where can I get that device? So you have it on your website, right? The Assisi Loop?
Assisi loops, we sure do. Yeah. And there's a 10 centimeter one and a 20 centimeter. And honestly, if you've got an older cat, get the bigger device because you're going to basically treat the whole cat at one go.
Yeah.
And
Yeah.
and you can just sort of put it under the blanket or whatever it is they like, and they love it.
Yeah. That's true. Okay, so that's awesome. What other ways to support, like supplement wise, do you often recommend, or at least recommend trying, depending on the cat? There's a lot of good
So
things.
sorry about that. I think my internet's a little slow, but one of the critical things I've really come to appreciate is CBD, and there are tons and tons and tons of products out there. But I believe that my friend Angela Ardolino's product at CBD Dog Health is the best on the market. She's developing mushroom tinctures as well that are more geared towards dogs, but really there's not a reason we can't use them for our kitties as well. But I mean, she is absolutely brilliant when it comes to developing these things. But I think those are critical. CBD is critical for cats to support kidney function. And
Would they need a low
really,
potency, or like a 250 to 300 milligram, or do they need more in the 500, or are we talking about 1,000 or more? What does she typically recommend for that?
So what we've all found sort of together is that, we started out with 2 milligrams. That's really not enough because the goal is to flood the endocannabinoid system so that it can go back to doing its work. For really critically ill pets, we may be giving 35 to 50 milligrams per day. And
Mm,
that's really critical to remember. It's not based on weight, it's based
right.
on how much does that individual animal need
Mm,
to help its endocannabinoid system work more effectively. For other pets, for other kitties, maybe it's 9 milligrams a day. So
mhm,
the deal is regardless of where your cat is, start low and work your
mhm.
way up slowly. The
Okay.
other cool thing is that with the Heal product, which is the most concentrated, you
Mhm,
can put it on the inside of the ear for cats that are like, oh no, you're not putting that in my mouth. So there
mhm.
is some transdermal absorption. It is slower, but it does work. And so if
Yeah.
that's your route, that's your only option, that's your only option.
Yes. Yes. Totally agree. Um, Good to know. What do you think about the humic or fulvic acid products? I know that Ion Gut Support for Pets has Dr. Zach Bush, who developed that, has done a ton of studies, but he's shown that that particular product also supports the kidney cell membrane, kind of the way it does the endothelial cells in the intestinal lining to help with leaky gut. So I've been recommending that for all of my kidney cats because it does help protect those cells, which can be, or they're so delicate,
Right.
what they're filtering through through the blood and everything can really do a lot of damage depending what's there.
Right. And so that's it. I mean, I've tried the product several times for different clients' pets, and in the list of in the list of things we can come to, I didn't see a terrific amount of benefit. But to be honest, I'm not seeing as many cats as you are, to be fair. So if you're
Mhm.
seeing good results, then go for it, because the
Yeah.
concept makes such great sense. It's going to prevent absorption of things like glyphosate from the GI tract, and the
Mhm.
idea is that it will help pull away the damaging immune molecules from attacking the kidney cells. So if
Yeah.
you're seeing results, then that's awesome.
I like a multi-prong approach. I don't think you can get results
Exactly.
with just doing one thing. So as many things as your cat will tolerate,
That's
and
the
that
key.
being the word, tolerate,
Yep.
because we can give them so many great tools because they all play an important role in this puzzle, of protecting, supporting the kidneys, supporting their function, and all of that. Um, so I love that we can combine things like the herbs, the Chinese herbs, the Ramanias, the the the
Exactly.
glandular products, things like that in conjunction with the omega-3s, which help with reducing inflammation, with products like the humic fulvic acid to support the kidney cells membranes, and then the diet, so we're not trying to dehydrate the body. So I think you have to look at it
Exactly.
multi-prong, what are all the different ways that we can support this? And then what will your cat let you do?
Exactly.
You
Exactly.
gotta have some buy-in.
Yes. Yeah. Because this is the other key thing too. If you have 20 supplements that all should do amazing things, but you're fighting your
Mhm.
cat every day, that's not cool because you're
Yeah.
destroying your relationship and you're
Mhm.
ultimately destroying the quality of life that the cat has. So
Yeah.
the deal is choose the things that you don't have to fight with. So for omega-3 fatty acids, a sardine is a great option because
Mhm.
a tin of sardines will get you 1,700 milligrams of omega-3 fatty acids. And so work with the things that you think your cat will be most likely to accommodate to, and then kind of expand from there.
No, that's a great advice. Um, so is there anything we've left out of your toolkit?
The one thing we started talking about causes of kidney
Mhm.
disease early on, and the thing that I didn't circle back to was frankly vaccines. And
Mhm.
this came out about 15 years ago, and then it sort of disappeared from the literature. But feline vaccinations are grown on cat kidney cells. So if
Mm,
you are working with a veterinarian that still thinks that annual vaccination is the way to go, then you need to really take a deep breath, get some information on titer testing, and talk with your doctor about it. I know that veterinarians are strong arming people into doing rabies vaccines, like literally cats and dogs that are sick. I won't work with your dog or cat until you've had a rabies vaccine, which is actually contraindicated. But I can make a case for doing a kitten series. And if that cat is an indoor only cat, then I would frankly go to titer testing from there.
mm,
Um, if they're an indoor outdoor cat, I would consider revaccinating at 18 months and then doing titers from there. But
mhm.
that's something so critical. And unfortunately, it's sort of left the literature. But if we're vaccinating cats with something that was grown in a kidney cell, we're also teaching their bodies not only how to produce antibodies against the virus, but sadly against the kidney cells. So the more times we do it, the more times we have the opportunity to create harm.
That is so important. I'm so glad you brought that up because that is a topic that's near and dear to my heart. Um, and frankly, I think it was just in the last year that I learned about that vaccines were grown in kidney cell tissue. It's like, well, no wonder there are so
Yeah, I
many.
mean, it's like, come on, guys,
I
really?
mean, between the over vaccinations that these cats get that are indoors and don't need them, and then the dry food diets, we're just really giving them a double whammy and setting them up
Yeah,
to fail.
yes. Yeah, sadly, it's true.
So the more education that we can share so that pet parents can be more knowledgeable, they can make more educated decisions when they're faced with these choices with, when their vets suggest something and they can go, well, wait a minute, in a very respectful way. It's like, well, that's interesting because according to this particular study and what I have learned and read, that's really not the best way to approach this particular situation. So,
No,
uh,
no, and
yeah,
a great place to start is to look at Dr. Ron Schultz's work with vaccinations,
absolutely.
and I think
Yes.
that's where you can provide the evidence to your veterinarian, that, really, guys, we've been duped. This came out in 1994.
Hmm. Yeah, he's one of my heroes. I wish
Yeah,
more
mine
doctors
too.
would listen to him. I
Yeah,
just, and
yeah,
he's a veterinary immunologist, not just a human immunologist. It's like he's done the work on the animals. He knows. Um, we have a question that says, what about homeopathy? I guess she's asking if there is any role that homeopathy can play in support for cats with kidney disease. Or do you know?
absolutely. And to be fair, that's not something that's in my wheelhouse, but there are many veterinarians that practice homeopathy, and
Mhm.
that can be a much easier route because the remedies are often in sugar pill or something like this that's much more palatable. But I
Right.
would, if you do back to vaccinations, I would use thuja, whether that's a homeopathic version or whether it's the mother tincture after the vaccines to help protect against the side effects for sure.
Hmm. Are there specific um, protocols? Like one of the lectures that you gave years ago, you talked about rhubarb root, like using a drop of
Hmm.
rhubarb root that can help stimulate the blood flow to the kidneys. Am I remembering correctly?
Yes, yeah, tastes nasty. So again, so so if I
Let's
could
pick
put
the
my
battle.
recommendations in order, here's what I
Yeah.
would say: food, omega-3
Yep.
fatty acids, probiotics, renal support, because usually it's not a fight to get that in. Well, CBD and renal support are I think CBD's popped over the top now. Renal
Mhm.
support, uh, quercetin, also great supplement, very bitter taste, rhubarb root, and then there's several others after that. But there's just, again, pick your battles. The interesting thing about rhubarb root is that there was a product on the market for a while made by Metoquinol. And essentially the FDA made them pull it because they were making claims that they couldn't, unless it was a prescription medication, because it actually worked, not only for heart disease, but for kidney function. So it improves blood flow to the kidney. It helps to reduce inflammation at the level of the nephron. In the heart, it works as a positive inotrope, meaning that it helps the heart function more efficiently.
Mm-hmm.
And so when that went from the market, I contacted them and sort of did the math backwards to a rhubarb root extract.
That's
So
amazing.
having said that, you can put it in an empty gel cap, and if your cat's into butter, you can just pop that down, that buttered up gel cap.
Yep. We have another really great question, and Regina, thank you so much for bringing this up. She talks about phosphorus binders, because sometimes
Hmm.
it's important and necessary to provide a type of phosphorus binder. Which, can you explain why a phosphorus binder would be used and when it would be used? And then, are there specific products that you would recommend for phosphorus binder?
Yes. And so here's the deal. When phosphorus goes way up with the creatinine, with the BUN, that's when they start to feel really awful. That's when the vomiting, the loss of appetite, the diarrhea can start. So to help your cat continue to feel good, it's really critical to use them. The chitosan option I've not found to be terribly effective. And so if you're going to commit to a phosphorus binder, um, the ones that are most commonly used are aluminum hydroxide products. Over time, that can create problems as far as aluminum toxicity and, frankly, constipation. And
Mm-hmm.
then there are some prescription drugs on the human side, one's called Savelamar. Veterinary internists are not too interested in that, but they did decide that lanthanum carbonate, I think, is an option. And so those are things that can be compounded into a liquid suspension that you can use. But as cats develop higher and higher phosphorus values, this is what you can really do to help them feel better on a daily basis.
And can you explain to people how those work?
Sure. I mean, literally, so what it does is take the phosphorus out of the GI tract and bind to it so that it does not get absorbed into the bloodstream to further elevate that phosphorus level. Does that make
So
sense?
yeah, the beautiful part is that the kidneys don't have to do all the work filtering all that out. So it just passes out through the poop.
Exactly. Exactly.
Down through the GI head. What about epichitin? Is that a chitosan product too?
It
I know.
is. It's a
Okay.
chitosan product. And
Okay.
so, it's been, yeah. So if your cat is like Pepe and will eat everything that's not nailed down and you're in a relatively early stage, then try it
Mhm.
and see what the
Mhm.
result is. But I've
Yeah.
not found it to be super effective, sadly. Have
Okay.
you had better success with it, Pam?
You know what? I haven't used that personally. The cat that I had that had kidney disease, I used the Phosphine by RX Vitamins, but I did not
Hmm.
realize that it had aluminum hydroxide in it.
Yeah.
And so now, if I had to go back and do it over again, I probably wouldn't use that all the time, but maybe rotating different phos binders so that we don't
Yes.
overload the aluminum the aluminum too
Yes.
much in the body, or you do constant detox for heavy metal because you don't want the aluminum being in there.
Exactly. And back in the day, because I am old enough to have been here, we used to use calcium carbonate, and
Uh-huh.
its downside is that it is not as effective as the aluminum hydroxide, but it is an option as well. But again, we have to watch for constipation.
You know what? There is a homeopathic remedy called calcarea carbon, calc
Yep.
carb, which is the calcium carbonate, but in homeopathic amounts. And my brain's just going, wonder about that.
Hmm. Yeah, that may be
You know,
helpful. Yeah.
I don't know. I'd have to muscle test it. I don't guess. I have to just figure it out.
Right on.
But
Right
yeah,
on.
this is great. Does anybody else have any other questions before we wrap up? I hope this has been really helpful. I think it's been fascinating on my end. Um, okay, so yes, she says, is eggshell powder safe or effective?
So
If they
that's calcium carbonate.
ah,
So yes,
very
you can
yeah.
certainly try it. Yeah. exactly.
And so if you're feeding your cat a raw diet instead of the bone, you can always use the eggshell calcium. And then one of the
And
things,
that's
go ahead.
actually, yeah, so if you don't use bone, if you're feeding raw or cooked, and that's part of why
Right.
I ended up using calcium citrate for the crock pet diet, because we don't want to add more phosphorus to the diet. Yeah.
Yeah.
So, and that's what's in bone meal is calcium and phosphorus.
One of the things that I recently learned in my own studies is that, with cats who have been diagnosed with kidney disease, if they eat a raw diet, their BUN might be a little elevated, but that doesn't mean that they have kidney disease. It's just because some cats who eat a raw diet are going to have slightly higher elevated levels, but it doesn't mean that they're sick, right?
Pam, that is such an important point. So again, I'm old enough. I'm started practicing over 30 years ago. When I started practice, a normal creatinine was 3 for a cat.
Mm,
That, I mean, granted, it was the top end of normal, but it was normal.
yeah.
And the urine specific gravity was something like 1035, 1040. And now a normal, I think, is 2.1 on most labs. And urine specific gravity is normal at 1045, 1050. And what that means is that your cat is already dehydrated.
Mm,
So, but yes, any fresh whole foods diets that favor protein over carbohydrates and fat, yes, the BUN and often the creatinine will be higher
a little.
than, yeah, but not where it's astronomically high.
Yeah. So don't freak out. It's what I just want people to don't freak out. If your numbers come back a little bit and you're feeding that kind of diet, just know that
Hmm.
it's in the norm and your
Right?
cat doesn't have kidney disease necessarily. So
Yeah,
yeah.
and go to the International Renal Interest Society's website, and you can download what the guidelines are, and this will help you understand where the issues are. So, for
Yeah.
instance, stage 2 kidney disease, cats live an average of 1,167 days. Well, if your cat's 9, that's a normal lifespan.
Mm-hmm. Mm-hmm. Exactly. Okay, so here's more questions. She says, what about the prescription drug Aventi for kidney disease? Do you know anything about that? And there's also
I
questions
don't,
about apple cider vinegar.
yeah, Aventi, I don't know. Let me take a look at what that is while we're talking. Apple cider vinegar does a lot of good for a lot of things, and it does help reduce inflammation. So, again, if that is something your cat's willing to buy into, go for
Mm-hmm.
it.
Yeah.
Yeah.
I'm looking.
And Avanti, okay. Maybe it's Avanti. Yeah. I don't know this one.
Might be new.
I think so. Yeah, I'm not finding it quickly and easily. I'm just finding compounds.
Yep. And
So sorry, don't know that one.
yeah, no, that's okay. Okay, another question is a high sodium value of 160 is a high sodium value 161 normal with kidney disease?
I think so this is the other thing, right? So here's the abnormal number, and this is where we
Mm,
put all of our focus, but let's look at what all of the ratios are.
yeah,
Um, so I think that's really critical to do is the sodium high but the chloride's low, or are the sodium and chloride high together? That would tell me maybe your cat's still a bit dehydrated. So I think you really have to look at all of everything in
everything.
relationship to each other. Yeah.
Yep. Okay. Um, Vanessa says, I've been feeding my cat rehydrated, dehydrated raw for years and only canned before that. His kidneys are now small and he's lost a lot of weight. Trying to keep weight on him. Do you have any recommendations?
Go with fresh.
Mhm.
So that even rehydrating, I think it's still not as good as
Nutrient
fresh.
dense. Yeah.
Yep. And then, CBD can be super helpful, help them feel better. There's a whole host of things. And again, Vanessa, you've got, a couple of bits of information in there, but this is where I think you really need to drill down with somebody like Pam, like a holistic pet health coach, to look at the whole picture, because one-off suggestions can be helpful, but they can also miss the entire point.
Yeah, I agree. And then Buffy says, what about aloe vera? Is aloe vera something that you would, a good supplement for? I know it's a good fiber source.
Yeah, I would think of that more in terms of gut health,
Yeah.
in terms of internal use, yeah, for nurturing the
Mhm.
enterocytes and helping them heal.
Yeah. Talk a minute before we wrap up about your crock pot diet, which is the cooked diet that some cats,
Right.
because some kidney cats, this is something I just learned from Dr. Katie Woodley not too long ago. She said some of these older kidney cats just do not do well on a raw diet. It's too cooling for them, so they need warmth, and so a cooked diet or like a gently cooked food is wonderful for kidney cats.
Right. And so here's the thing. I mean, and Vanessa, congratulations. If your kitty is 19, you have done well by him. Absolutely.
Yes. Mhm.
So here's the deal. I was trained in traditional Chinese veterinary medicine. And so again, the spleen abhors cold and damp. Raw food is cold and damp. And what I found in practice was that I was treating a lot of cats and a lot of dogs that were eating raw diet for gut issues because the gut just couldn't deal with it. So, and conversely, if they were coming off of dry and canned food, they wouldn't eat raw because the taste, texture, et cetera, just wasn't happy. So, the concept is it's not gently cooked, it's cooked relatively thoroughly. But the idea is that we're turning this into a pre-digested meal so that that cat, that dog can absorb the nutrients very easily without having problems without a if their gut function is off, it's much easier for them to actually absorb the nutrients. And you can make it as soupy, so you can add water to it if the cat will put up to it. um, some of them will appreciate that texture, some of them won't, but it does help to
Mhm.
get more water in. And
Mhm.
we can use foods like kale, like broccoli, that will help improve liver function, which
Mm.
again helps aid the detoxification process and again takes some of the edge off of the kidneys. So
Wonderful.
it's super simple. Literally, you can prepare it in about 15 minutes, throw it into a slow cooker, a crock pot, and then freeze it up according to how much your cat would eat in 3 to 5 days.
Mhm. Absolutely. And we have put Dr. Ruth's website link at the top of these comments. So if you guys want to go click on that link, you can go explore her website with the crock pot diet and things like that as well. Um, I can't believe it's already been an hour. Do you have
Wow.
any last comments as we wrap things up here?
Trust your instincts. If something doesn't sound right, investigate it. Investigate it with people that are providing information and not selling you supplements so that the supplements may be appropriate, but make sure you're getting the information straight up.
Mhm. That's great advice. Um, and then how old was your last cat that you had?
Well, so Romy lived to be 24.
Oh my,
um,
can y'all,
yeah,
it's that's phenomenal. That's
and
phenomenal.
so she's the one that we took a long time to transition her from dry to canned, from canned to cooked. So 6 months from dry to canned, 3 months from canned to cooked. At 23, she said, "I am not eating that anymore, and where is my Friskies, damn it?" So, at 23, okay. But that's the thing, you have to respect what they're telling you, and, she's like, "Nah, I'm only 135, so I'm gonna eat Friskies now."
Right, right, and
Okay.
I totally respect that because we were talking earlier before we came on. I had a cat, her name was Lily, and she had stage 3 kidney disease because of a kidney infection that left it did a lot of damage, but through nutrition and through supplementation, she thrived for 8 years until like yours. One day she just up and said, I'm not eating those supplements anymore. You can take them out of my food or I'm not eating the food. And so I did. And I knew what that meant, but I honored her, because it wasn't worth forcing stuff down her that she didn't want and ruining that relationship, knowing that, it's just about quality of time at this point. When they're done, they're like, okay, I'm done. And you just
I'm done.
You have to respect that at some point. They
do.
don't live forever, and unfortunately, they don't live forever, and organs eventually wear out. Our bodies wear out. I mean, that's just how they're designed. They don't last. So we just enjoy every moment we can for as long as we have.
Amen.
Yes. So. Oh, well, thank you so much for your time. And I hope you guys found this informative and helpful. If you would please share this with anybody that has a cat so that we can save cats from developing this, kidney disease, and help them get on the right track early so they don't develop this kidney disease. That's my best advice. Be proactive and work in prevention so that you're not having to deal with, the hard stuff later on. So anyway.
Exactly.
So anyway, thank you guys so much. We will be back next month with more fun and excitement. So thank you again, Dr. Roberts, for joining us. We truly appreciate you. It's an honor to listen and sit in on your wisdom and your expertise and advice. And we so appreciate you.
Pam, it was my pleasure.
So y'all have a great rest of your day, and we'll see you next time. Thank you.
Okay.